Hello friends, in the first part of the discussion about pathogenic microbes, it is necessary to understand what microbes are and how they are proved pathogenic. Part 1. Basic introduction and pathogenic characteristics. Microbes are basically products of evolution which are not observed by our naked eye. Consequence of natural selection operating upon vast array of genetically diverse organisms. Basically, they fall into various forms or categories. They include virus, bacteria, Rickettsiae, Spirochaotes, and eukaryotic life forms such as fungi, protozoans, mycoplasma, and even non-nucleic life such as prions. Each of these forms have their characterized pathogenic behavior. Now let us talk about the nature of pathogen and how do they cause diseases. Normally, we think of pathogens in hostile terms as invaders that attack our body. But a pathogen or a parasite, like any other organism, is simply trying to live and procreate. Microbes can cause a multitude of different infections ranging in severity from unapparent to fulminating. They have their own mechanism of adherence to host to carry out a successive infection. In this section, we discuss some of the common features that microbes must have in order to be infectious. For a successful infection, pathogen should enter the host, have ability to remain in a location while the infection gets established, avoid, evade, or compromise the host defenses, damage the host, exit from host, and survive till transmitted to another host. Before we begin our discussion, let us define portal of entry. It is any point at which pathogens can enter the body. Entry in humans is relatively easy as major part of the body is exposed to outside environment. Part 2. Specific mechanism and host pathogen relationship. Now friends, let us discuss second part of the specific mechanisms involved for pathogen to interact with the hosts. The human body is a complex and thriving ecosystem. It contains about 1013 human cells and about 1014 microbial species. If it is normal for us to live in such close intimacy with a wide variety of microbes, how is it that some of them are capable of causing us illness or death? An interesting and most pioneering experiment was performed by Robert Koch to determine if a microbe caused a specific disease. The criteria of his postulates include: the microbe must be present in every case of the disease, the organism must be grown in a pure culture from diseased hosts, a cultured microbe should cause disease when introduced into a susceptible host, the organism must be recovered from the experimentally infected hosts. Coming to the point of mechanisms of pathogenesis, it is the method by which a disease can develop. Mechanism is explained in following steps: transmission, adherence, invasion, colonization, evasion of host defenses, damage and disease to host tissues, and finally exit from the body. Let us discuss transmission. Disease causing agents can be spread from animal to animal or animal to humans through a variety of transmission routes: aerosol, fomite, oral, direct contact, reproductive, vector-borne, zoonosis, and most venerable nosocomial infections. Second step of pathogenesis is adherence. Microbes gain a stable foothold at the portal of entry. Depending on binding between specific molecules on host and pathogen through fimbriae, flagella, adhesive slimes or capsules, cilia, suckers, hooks and barbs. Third step of pathogenesis is invasiveness, ability of a pathogen to grow in host that inhibit host function can cause damage without producing a toxin. Fourth step is colonization. The ability of nutrients is most important for pathogens to grow locally at the site of invasion or may spread throughout the body. Fifth step of pathogenesis is evasion of host defenses. Protect the pathogen by interfering with host defense mechanisms. Sixth step, damage and disease to host tissues. Pathogens produce enzymes that enhance virulence by breaking down or altering host tissue to provide access and nutrients. And lastly, seventh step, exit from body. Pathogens depart by a specific avenue, greatly influences the dissemination of infection through mucus, sputum, nasal drainage and saliva, skin scales, fecal exit, urogenital tract and removal of blood. Part 3, Causative Agents and Diseases. In the third part of the discussion of Introduction to Pathogenic Microbes, we will discuss about various microbes causing various diseases. They can be easily understood with examples. First, let us discuss virus as a form of microbe. Few of the examples of human pathogenic viruses and diseases includes human influenza, causative agent, influenza virus. Symptoms: fever, headache, myalgia, lethargy, coryza, sore throat and cough, and gastrointestinal symptoms such as nausea, vomiting and diarrhea in children. Chicken pox, causative agent, varicella zoster. Symptom: low grade fever, malaise and rash, predominant vesicular eruption, debilitating complication and prolonged pain. Rabies, causative agent, rhabdovirus. Symptoms: weakness or discomfort, fever, headache, cerebral dysfunction, anxiety, confusion, abnormal behavior, hallucinations and insomnia. AIDS, causative agent, human immunodeficiency virus. Symptoms include fever and fatigue, sore throat and swollen glands, rash, headache, rapid weight loss, recurring fever and profuse night sweats, prolonged swelling of the lymph glands, diarrhea, blotches and sores of the mouth, anus and genitals, pneumonia, memory loss, depression and neurologic disorders. Common cold, causative agents, 200 kinds of viruses. Symptoms include nasal discharge, obstruction of nasal breathing, swelling of the sinus membranes, sneezing, sore throat, cough and headache. Polio, causative agent, human enterovirus. Symptoms: poliomyelitis is a crippling disease of spinal nerve cells caused by poliovirus infection. The disease can strike at any age but affects mainly children and causes paralysis in one case of every 200 to 1000 infections. Shingles, causative agent, varicella zoster virus. Symptoms usually seen in adults after exposure to dormant chickenpox during childhood. Measles, causative agent, paramyxovirus. Symptoms: infected children will have a rash, high fever, cough, runny nose and watery eyes with complex spots. Warts: causative agent human papillomavirus. Symptoms: non-cancerous skin growths in the top layer of the skin. Hepatitis: causative agent hepatitis A virus. Symptoms: serious liver infection with acute fever, malaise, anorexia, nausea and abdominal discomfort. Next form of microbe is Rickettsiae. Diseases include Rocky Mountain spotted fever. Causative agent Rickettsiae. Symptoms: damage to the blood vessels, visible hemorrhages. Rickettsial pox. Causative agent Rickettsia acari. Symptoms: blister like rashes on skin. Brill-Zinsser disease. Causative agent Rickettsia prowazekii. Symptoms: recrudescent typhus fever, itching, aberrance in skin. Murine typhus. Causative agent Rickettsia typhi. Symptoms: infectious skin, respiratory tract or conjunctiva. Clinical involvement affects the brain, lungs and visceral organs. Mortality less than 1%. The other form of pathogenic microbe is Spirochaetes. Few of disease causing members of this group include the following: Leptospira species, which causes leptospirosis; Borrelia burgdorferi, Borrelia garini and Borrelia afzeli cause Lyme disease; Borrelia recurrentis, which causes relapsing fever; Treponema pallidum, subspecies which causes treponematosis such as syphilis and yaws; Brachyspira pilosicoli and Brachyspiral borgi, which cause intestinal spirochetosis. Let us illustrate bacteria as the most common form of microbe. Diseases include anthrax. Causative agent Bacillus anthracis. Symptoms: respiratory infection with initial cold or flu-like symptoms followed by respiratory collapse. Tuberculosis. Causative agent Mycobacterium tuberculosis. Symptoms: prolonged cough, chest pain and hemoptysis. Systemic symptoms include low-grade remittent fever, chills, night sweats, appetite loss, weight loss and production of mucoid to purulent sputum. Typhoid fever. Causative agent Salmonella typhi. Symptoms: cold or flu-like symptoms and general debility. Diphtheria. Causative agent Corynebacterium diphtheriae. Symptoms: an upper respiratory tract illness with sore throat and low fever. A milder form of diphtheria can be restricted through the skin causing myocarditis, about 20% of cases, and peripheral neuropathy, about 10%. Botulinism. Causative agent Clostridium botulinum. Symptoms begin with weakness, trouble seeing and speaking, followed by pain in arms, chest muscles and legs. Tetanus. Causative agent Clostridium tetani. Symptoms: chills, difficulty swallowing, headache, irritability, jaw and neck stiffness, low fever, restlessness, stiff arms and legs. Gonorrhea, causative agent Neisseria gonorrhoeae. Symptoms: gonorrhea symptoms in women and in men are different. In women, symptoms are abdominal or pelvic pain, burning when urinating, conjunctivitis, bleeding between periods with vaginal discharges, spotting after intercourse, swelling of the vulva, burning sensation in the throat due to swollen glands. While on the other hand, symptoms in men are greenish yellow or whitish discharge from the penis, burning when urinating, and painful or swollen testicles. Syphilis, causative agent Treponema pallidum. Symptoms include: primary syphilis manifests as an ulcer or canker at the infection site. Secondary syphilis with rash, mucocutaneous lesions and adenopathy. Latent syphilis is asymptomatic but may be detected by serologic tests. It is classified as early, late or of unknown duration. Tertiary syphilis manifests with neurologic or less commonly with gummatous or cardiovascular symptoms. Neurosyphilis can manifest as asymptomatic meningitis, symptomatic meningitis, meningovesicular disease and cranial nerve dysfunction. Congenital syphilis is acquired in utero and represents a devastating and entirely preventable to the offspring of women with untreated syphilis at pregnancy. Now, let us discuss chlamydia as a form of pathogenic bacteria. Chlamydia that causes infections in humans are: Chlamydia trachomatis causes trachoma, lymphogranulomavenarium and chlamydia. Chlamydia psittaci causes infections in parrots, turkeys and similar birds, but in humans can cause very serious illness. Chlamydia pneumoniae causes pneumonia. Friends, let us have a glimpse on other forms such as fungi, protozoans and prions. Fungi causes aspergillosis, blastomycosis, candidiasis, coccidioidomycosis, coccidioidomycosis neoformans cryptococcosis, coccidioidomycosis gatticryptococcosis, dermatophytes, keratitis, histoplasmosis, mucormycosis, pneumocystis and sporotrichosis. Protozoans cause giardiasis, African sleeping sickness, malaria, leishmaniasis and vaginitis. In humans, prions cause Creutzfeldt-Jakob disease, Kurtzman-Straussler-Schimker syndrome, fetal familial insomnia and Kuru. All of these diseases are fatal and may cause death to humans unless there is due care, effective medication and proper treatment at primary stages. Part 4: Prevention, Control and Treatment. All human beings want to live a healthy life, isn't? So, in this part, we will study how these venerable diseases are controlled and what are the treatments to cure, eliminate or eradicate diseases. Prevention. As we know, prevention is better than cure. The goals of medicine are to promote health, to preserve health, to restore health and to minimize suffering and distress. The concept of prevention is best defined in context of levels, traditionally called primary, secondary and tertiary prevention. A fourth level called primordial prevention was later added. Determinants of prevention. Successful prevention depends upon a knowledge of causation, dynamics of transmission, identification of risk factors and risk groups, availability of prophylactic or early detection and treatment measures, and organization for applying measures to appropriate persons or groups, and continuous evaluation of and development of procedures applied. Now, for a disease to stop its prevalence, it is necessary to focus on word control. The term control describes ongoing operations aimed at reducing the incidence of disease, the duration of disease and consequently the risk of transmission. Control activities focus on primary or secondary prevention, but most programs combine both. The effects of infection include both the physical and psychosocial complications. And the last, financial burden to the community. For above all discussions, if there is effective treatment, then there is a clear picture that medication will serve to solve the following goals: to alleviate symptoms and then to slow down progression of disease. But to what extent it is effective? Remember, general rule won't work for severe disease. Sometimes treatment may be beneficial and noted immediately in some disorders. Sometimes the benefits of treatment may take few months to notice. Sometimes some patients may not benefit from therapy. Remember, treatment must be tailored by the patient's physician to meet that patient's need only. Summary. Friends, now it's a time for us to live healthy and free from these dangerous microbial creatures. But how? After all this discussion, let us try to summarize what we learned. Friends, we learned how infectious diseases are caused by pathogens. Pathogens of all classes must have mechanisms for entering their host, for evading immediate destruction by the host immune system to be diseased. Goals are embodied in the word prevention. So let us end with one motto: eradicate all evils, whether it may be physical, mental or psychological even. Thanks for listening, and eventually do cooperate for eradicating disease rather than its elimination, along with those who seek and pray to God or who keeps in faith to science for healthy lives. Thanks, and live a healthy, disease-free life.